Hello, my name is Garrett Clark, and now that you know how to take your blood pressure, how can we help manage it? Our primary goals are going to be to reduce high blood pressure, prevent or delay the development of high blood pressure, and enhance the effectiveness of blood pressure medications. Before we get started, we would like you to take a moment to take this brief survey. First, we need to keep a record of your blood pressure recordings. This will help you and your physician track your changes or any anomalies. This can also be helpful with obtaining an accurate reading, as some people have white coat hypertension, where their blood pressure is higher in the doctor's office. You can keep a simple paper journal by recording the date and blood pressure values taken in the morning and late afternoon, or you may find ccctracker.com helpful for keeping a digital journal. So the primary way to manage blood pressure is through lifestyle modifications, including diet and exercise. There are several things to look out for in diets, and one thing that is highly stressed is sodium or salt intake. High sodium diets can increase blood pressure, so it's recommended to get less than 1500 milligrams per day of sodium. It may also be a good idea to keep track of your daily sodium intake in a journal, as you would with your blood pressure. While table salt is one source of sodium, many processors and packaged foods have high sodium content, so it's always a good idea to look at the nutritional labels. A single slice of pizza, for example, can almost be a third of the recommended limit of sodium. You can also ask for food to be prepared without salt and use lemon and pepper instead. There's actually a whole list of alternative spices such as cinnamon, ginger, and nutmeg that you can use to give your food flavor instead of salt. We also want to keep cholesterol low by avoiding saturated fats and trans fats. This is because trans fats raise blood pressure, or they raise bad cholesterol, known as LDL, and they lower good cholesterol, known as HDL. We also want to try to limit red meats, only eating the leanest cuts, and more preferentially eating skinless poultry and fish instead. Drinking too much alcohol may also raise blood pressure. It is recommended that men drink 2 or fewer drinks per day, and women drink 1 or less per day. A drink consists of a 12-ounce beer or 4-ounce wine, for example. Sweets and sugary beverages, such as pop, should also be limited. And on the other hand, we should aim to get plenty of fruits and vegetables, nuts and legumes, and maintain a low-fat dairy and fish to increase potassium. So we want to kind of try to aim to increase potassium because it increases the amount of sodium that is lost in the urine. So you should always consult your PCP or your primary care provider first, though, as it may cause problems with certain medications and kidney disease. Another great way to tackle high blood pressure is through exercise. Regular activity helps reduce weight, relieves stress, and lowers blood pressure. The aim is to get at least 150 minutes of exercise per week over multiple days. The activity could be as simple as briskly walking or partaking in dance classes. It is a good idea, however, to include flexibility exercises such as yoga and stretching, as well as strength exercises at least twice a week. Something like inclined push-ups or push-ups against a wall would be considered a strength exercise. If you stop exercising too quickly, your blood pressure can drop sharply, which can be dangerous and can cause muscle cramping. So it is important to always warm up and cool down before exercising. While exercising, it is important to breathe regularly throughout your warm-up, exercise routine, and cool down. This is because holding your breath can also raise your blood pressure and can cause muscle cramping. With all of these diet and exercise modifications, you may also lose weight, which can lower your blood pressure. Other lifestyle factors such as stress can also have an impact on your blood pressure. Situational stress causes the release of stress hormones known as adrenaline and cortisol into the blood. These hormones prepare the body for a fight or flight response by making your heart beat faster and constricting your blood vessels. The constriction of blood vessels and increase in heart rate raises blood pressure, but only temporarily. The long-term effects are still being studied, but stress can lead to poor diet and inactivity as a way to cope. Smoking and secondhand smoke also temporarily raise blood pressure and contributes to atherosclerosis, or plaque buildup, which is already increased by hypertension. Caffeine, such as coffee, temporarily also raises blood pressure and can lead to irregular readings. If your high blood pressure can't be adequately controlled with lifestyle modifications, your provider may want you to take medications. High blood pressure is lifelong and may require multiple medications. You should always take these medications as prescribed and avoid skipping or splitting doses. There are many different types of medications to help combat high blood pressure, but some common types are diuretics or water pills, which work by removing the excess sodium and water from the body, and beta blockers, which reduce heart rate and workload of the heart. As a management is a partnership with you and your provider, it is important to tell your provider about any over-the-counter medications that you may also be taking. Many decongestants found in some over-the-counter cold and flu preparations may raise your blood pressure, for example, and other medications such as ibuprofen, amphetamines, and antidepressants may also have an impact. Some medications may also be high in sodium or labeled as soda on the bottle, which may raise blood pressure as we mentioned earlier. It is very important, however, that you do not stop taking any prescribed medications without discussing with your healthcare provider. It is also important to point out that it is the combination of both medications and lifestyle modifications that control the blood pressure. So if you start taking medications and your blood pressure becomes controlled, it is important to continue making healthy life choices. It is not the medications on their own that are controlling your blood pressure. High blood pressure is a lifelong disorder, but through lifestyle modifications and medications, it is manageable. Finally, we wanted to leave you with some questions that you may find helpful to ask your doctor, such as, is my blood pressure under adequate control? What would be a healthy weight for me? Is it safe for me to start doing regular activities? So like the pre-survey, we also have a post-survey that we would like you to take. Thanks for joining us today, and let us know if you have any questions. Thanks.